Riverside County is 6th on the list of statewide cases of monkeypox, with our county now sitting at 34 probable or confirmed cases. And many of you have questions about monkeypox, including how it spread and how to protect yourself. Today, I took those questions straight to the Chief Medical Officer of Eisenhower Health, Dr. Alan Williamson. Dr. Williamson, first off, let me start by asking you just how easy is it to get monkeypox? For example, can you get it at a crowded bar that's full of sweaty people or from gym equipment?
Hi, Peter. How are you? That's a very good question. Monkeypox can potentially be spread by contact with surfaces that are contaminated with the virus. But the good news is monkeypox is susceptible, the virus causing monkeypox is susceptible to the normal disinfecting solutions that we typically use. So it is not highly resistant to disinfection. So if we're routinely wiping down equipment at the gym, for example, after people are using that, that should be sufficient to rid that equipment of the virus causing monkeypox. So we don't believe that's a particularly high risk, but theoretically it can be spread by contact with other surfaces.
And what about just by brushing up against someone?
Yeah, unless they have open sores. Really, at this point, it appears to be more prolonged direct skin-to-skin contact with patients that have an active rash and have open sores. It is conceivable to spread monkeypox through clothing, through linens. So all of this is theoretically possible. Again, it does appear, however, the vast majority of cases that are being seen are being transmitted more by direct and more prolonged skin-to-skin contact.
Of the cases that you've seen, were they spread through sexual contact?
We do believe that the majority of the cases that we're seeing have been spread directly through sexual contact.
So then that almost begs the question, should monkeypox be considered more of an STD?
You know, at this stage, that's true. You know, it is interesting to sort of debate this point, I suppose. It's not a disease specifically of men, let alone gay men or bisexual men and so on. But what we are seeing in terms of the mode of transmission right now is really primarily related to sexual contact. And again, for the moment, sexual contact between men seems to be the mode of transfer in virtually all the cases we've seen. There certainly is the possibility, however, that this disease can then spread beyond that, and it could easily spread to women and to children. We've seen a few cases already in this country, of cases of children, being infected with monkeypox. So all of that is certainly possible. But right at the moment, what we are seeing is a disease that is being spread primarily through male-to-male sexual contact.
So at this point, here in our region, you have not seen any women or children infected with monkeypox. It's all been gay men?
That's correct. At this point, we've not seen any women or children.
So what should someone do if they're concerned that they may have come in contact with someone who had monkeypox, or if they start to show symptoms of monkeypox?
Yeah, if you believe you may have contacted someone who has a rash, who has symptoms consistent with monkeypox, I would recommend contacting the Riverside County Department of Public Health so that they can get you directed to a site where potentially you can be evaluated and vaccinated against monkeypox. There is an effective vaccine for monkeypox, but it is important that that be administered as early as possible after exposure. There's evidence that shows that if we're able to vaccinate individuals within 4 days of their exposure, it can prevent disease. And within 14 days of exposure, it seems to diminish the severity of the disease that the patient experiences. Beyond 14 days, it's unclear whether there's any benefit for vaccination at this point. So it would be important to try to get in touch with the county health department, because at this point they are controlling the distribution of the vaccine. It's not something that we can just order from the suppliers somewhere. It's coming directly from the county public health department. We hope in the future to certainly see more vaccine available, and we can begin talking about more routine vaccination to try to prevent infections and from people who have not yet been exposed. But at this point, we are still working again with the county under their direction at just doing post-exposure prophylaxis.
So people concerned they may have monkeypox contact the county first. Should they go to an ER?
No, if they have a primary care physician, I would strongly encourage them to contact their primary care physician to discuss what symptoms they are having. We would definitely ask that they try to avoid going directly to the physician's office without any contact ahead of time by phone or to urgent cares or emergency rooms because you may unnecessarily potentially expose other people. There is testing that can be arranged and so on. And if we have notice ahead of time, we're happy to have patients come in and see their physician to be tested against monkeypox. But we would prefer that they contact us by telephone ahead of time to make those arrangements so that we don't expose potentially high-risk candidates. We do have other patients who have compromised immune systems and so on that we want to try to be sure we protect all of our patients to the best of our ability.
Some of our viewers would like to know if they were vaccinated against smallpox as a child. Does that provide any level of protection against monkeypox?
Yeah, that's another excellent question. There is evidence that there is at least some crossover. These are very similar viruses. They both fall into the same class of viruses called orthopox viruses. And it does appear that those of us who were over 50, who were typically routinely vaccinated against smallpox in our childhood, do have at least some degree of immunity against the monkeypox virus. There's a little bit of conflicting information, certainly for those folks who are potentially exposed to the virus directly, laboratory workers and so on that are really working directly with this virus. There is recommendation that they have booster vaccination against monkeypox. But again, for the more typical casual contact type situations, I think that if you were immunized against smallpox, there's probably a reasonable degree of immunity against monkeypox at this point.
Let me ask you, Dr. Williamson, how concerned are you about monkeypox and how hard it may hit our valley?
Yeah, I am very concerned in terms of the number of cases I think we will see. We do have a population, unfortunately, that is at risk here based on the number of gay individuals that we have in the community. So I do think the trend line that we are seeing is disturbing, that the number of cases is growing quite rapidly. The only silver lining, I think, to this cloud is, in general, monkeypox is usually not a highly virulent disease, doesn't usually cause severe disease and death. Fortunately, deaths have been quite rare even worldwide. Having said that, however, we do have to be concerned about some of our patients, some of our individuals in the community are very immunocompromised. They may have poorly controlled or late stages of HIV disease and so on that unfortunately does put them at higher risk for more severe disease. So, I am concerned that this could have an impact on our community. We need to be very careful about watching how this progresses and continuing all the efforts that we are currently working on with county and state and federal officials to get access to vaccine just as quickly as we possibly can.
So the bottom line here, Dr. Williamson, what is the message that you want, not just the gay community here, but for everyone to hear about monkeypox, and what do they need to do to protect themselves?
That a lot of the basic hygiene things that we talk about, good hand washing and so on, are really still very important steps for dealing with this outbreak of disease. Monkeypox is very susceptible to alcohol-based hand sanitizers, very susceptible to common soap and water and so on. So those are all important measures. And then for our gay community, we do need to have some serious discussions about exposure to multiple sex partners and anonymous sex partners and so on that we know unfortunately put people at much higher risk for the spread of this disease. And then I think lastly, again, be aware of the symptoms of monkeypox, be aware of the rash that typically appears. The vast majority of patients do develop a rash. Many, if not most of them, also get some basic viral type symptoms, headache, fever, malaria, malaise, body aches, and so on. But the rash is really the most common thing that we see, particularly around the mouth, around the genital area, but it can involve really anywhere in the body.
Dr. Williamson, thanks so much for answering all our questions. We appreciate your time.
You're welcome, Peter. Thank you.